If you had to guess, what is the most common surgery performed here in the United States, what would you say? Well, if you guessed cataract removal, you'd be right. That's right. More cataract surgeries than any other type of surgery. And someone who's an expert about that is Dr. Jacob Mong, here to tell us about an amazing breakthrough procedure that is now available here in the Treasure Valley. Welcome today.
Hey, thank you, Claudia. It's good to be here.
I am hoping that you can clear up all my questions about cataracts, but really you've brought something revolutionary here. And we think of cataracts in our aged population, very common. In fact, everybody has the potential to get a cataract.
That's right, Claudia. If you live long enough, everyone's going to end up with a cataract. It's one of those things I tease patients. It's like gray hair and wrinkles. If you have enough birthdays, it gets to be one of your presents.
Thank you very much. But there's something that we can do about it, and it's not just a vanity thing for not wearing glasses. New research says that it improves the quality of life, but also how long you live. Why is that?
Yeah, so that's a really interesting study. I'm glad you brought it up. The study is interesting for several reasons, and it was a well-conducted study, and it came out in the last year, where it showed 70,000 women that were studied actually lived longer if they had cataract surgery. Now this is interesting, right? We're not doing anything to their heart or their lungs or their cardiovascular system. We're not preventing cancer. What we're doing is enhancing one of their senses. And in doing so, you can improve the quality of someone's life. You see, a cataract affects everything. It affects our vision, and that's what we see the world, or how we see the world, excuse me. And that's how we do the things that we love, the things we do every day, and that in turn affects our lives. And so what they showed was these women that had cataract surgery actually lived longer. So they improved the quality of their life, but also improved the quantity.
Why do you think the study was done on women?
Well, if you look at the statistics, women tend to get cataracts earlier. And the reasons aren't perfectly clear, but we think it's due to the same reason that women are typically different than men, and that's hormones. Women go through something called menopause, and during that time, estrogen levels fluctuate and change. And we believe the material in the lens of the eye is susceptible to these hormonal changes. And women tend to develop cataracts earlier than men.
Okay, so a little background on cataracts. You said they may be affected by hormone levels. What else determines the onset of cataracts besides age?
Sure. You know, cataracts are an aging process, but anything that will accelerate that aging process. So oxidative damage, which is what we call the aging process, can come from UV light exposure. So being out in the sun can actually cause cataracts. Anything that causes oxidative stress on the cells of the body, what we call our free radicals, smoking, certain medications can cause it. And these all contribute to accelerated cataract growth. And in turn, birthdays. If you live long enough, the cells in the body age, and the cells in the lens of the eye actually don't replicate or replace. Those are the same proteins that you were born with.
Oh, there's no turnover, no renewal that improves things.
That's correct.
You got what you got.
That's correct.
So why don't you show us, when you're talking about the lens, let's look at a little of the anatomy and what you do in a typical cataract surgery, and then I want to take you to this new and improved version of getting rid of cataracts.
I love models of the eye because it makes so much more sense when you can understand what we're talking about. So the human eye, you imagine, is a globe, and you remove this here so that we can have a view. We don't actually do that in surgery. All right, and on the front you have the cornea, and this was what people commonly think of when they think of the lens of the eye, but that's not actually the case. The cornea is a protective layer, and it does some refraction. It acts like a pair of glasses, but the true refracting power, the lens of the eye, is back behind the pupil, and it's right here. And what a cataract is when this clear lens becomes cloudy. And as that happens over time, no matter what you do with glasses up front or LASIK surgery on the front of the eye, you don't improve the cloudy lens. And so with cataract surgery, we remove this lens and put a new clear lens in its place.
And traditionally, and you still do use in your practice, tools like this, and you would, under a microscope, actually cut open the eye.
That's correct. You know, traditional cataract surgery here in America for the past 20 to 30 years has used a 2 to 3 blade approach where multiple incisions are made in the eye using blades similar to these. They run between 2.5 and 3 millimeters, and what these blades are used to do is open the eye, remove the lens, and allow for passage of the new lens to be implanted.
Okay, so what the new technology takes us from here to what? Tell us the name of it and what you're able to do now.
Right, so what we're talking about today is laser cataract surgery using something called a femtosecond laser. And in the past decade, advancements have been made with lasers to the point that we no longer need these instruments for cataract surgery. So before, a surgery that was entirely dependent on how steady your surgeon's hand was, on their skill level, on the preoperative measurements and what they assumed would help, now can be done in real time with a laser with perfect precision. And the healing time is quicker, there's less pain, there's less inflammation, and the results are unprecedented.
Oh, it sounds amazing. So the technology is so new to Boise. What if you've been practicing here for a few years, what did your patients that wanted this do before?
Right, you know, the technology's been out for a few years, but it hasn't been here in the Treasure Valley. Patients that had complex surgeries or that really wanted these refractive outcomes where they wanted to be out of glasses and they wanted results where they didn't have pain and really wanted the best, we had to send them out of state to Salt Lake or Seattle, which was very inconvenient and frustrating because the technology existed. We simply didn't have it here in the Treasure Valley.
So they would go somewhere, get the surgery, but what about when it's over? Do you have to go travel and see that doctor again? Because I'm imagining you bringing it here has sort of changed all of that.
That's right. You know, we brought it for several reasons. One, because it really is the best thing out there, and I think our patients deserve that. But there are patients that you shouldn't even do without this surgery. I mean, it makes things so much simpler. And now that we have it, we follow our own post-ops. We're no longer sending them out of state. So patients have an option to have the surgery without the travel.
That is so reassuring.
It's truly an amazing technology, and I think it's going to be the standard of care across America in a few years.
Okay, so I can't imagine what you do for people. What are some of the before and after stories, if you will?
You know, there are so many of them, it's hard to pick one. Patients in general notice that things are brighter. Things are more crisp. If we're shooting for custom outcomes where they can see distance, intermediate, and near, they're getting vision back that they haven't had since they were 20. Many times, vision they've never had.
Okay, so you're not just correcting it like giving them a pair of glasses. You're, in some cases, perfecting. They're getting vision results that better than they've ever had.
Welcome to the 21st century with cataract surgery. It's come so far that we're no longer just removing a dirty lens. We're trying to give them outcomes similar to what people imagine when they hear the word LASIK surgery. We're trying to get them out of their glasses so that not only can they see clearly, but they can see clearly without any help.
All right, and that's kind of what this little guy has to do with. Explain this to me.
Right, so when we remove the natural lens of the eye, obviously this is not a to-scale model. We implant a small lens in the eye that will stay with the patient the rest of their life. And this lens is customized to have that patient's prescription built into it. And this is an actual lens, and you can see the central optic. That's what a patient will look through. And there's two little arms that hold it in place, and that's what stabilizes the lens.
And so it's like inserting their prescription into their eye.
That's right. It's a permanent implant with their prescription.
Wow. Now that is not the only revolutionary new sort of thing that you're doing. You have another device called, or is it a device or a process that's called Aura?
It's actually both.
Oh.
In the last few years, there's been more technology developed to even further fine-tune cataract surgery. What I just talked to you about, these outcomes where patients don't need glasses, relies on how accurate our measurements are to calculate that lens that I'm implanting. Because that lens is permanent. Once we implant it, you want it right. So what Aura does, and it's a technology that's attached to our microscopes and then built into the operating room, it allows us to remove the cataract and recheck all the measurements, and under ideal conditions where the patient is still and the cataract is gone, we're able to measure the prescription. And this allows us to fine-tune the lens itself, pick the correct one, and even align it properly. And then after it's in, we can check again and make sure that there's no surprise nearsighted or farsightedness.
Now this is taking my mind back when you go to an optometrist and manually they put all the different lenses in front of you, but now there's a device that does it, so when you're in surgery,
That's
you know
right.
you have the right.
No longer are you surprised the next day if you find out that you need a little help on that device.
Huh.
This way I can say, well, that lens isn't going to work, let's change it. And we eliminate the surprises.
Wow, amazing. So what is recovery like for this? What's going to happen when someone goes in to have this cataract surgery?
You know, cataract surgery is the most common surgery in America, and that's for a reason. It's because it's a quick procedure with great results. And when people hear surgery, oftentimes they think of other surgeries where there's a prolonged recovery. There's pain, there's inflammation, there's restrictions. With cataract surgery, we don't have those. It's about a 15-minute procedure. You go home the same day. Typically, you're in the surgery center for less than an hour. Patients have to use drops for a couple of weeks, but every day their vision continues to improve. There's some restrictions on how much they're supposed to lift, so if a patient's a weightlifter, I recommend they hold off for a week. But other than that, there's no restrictions. They're not bedridden.
Wow, it must be so rewarding what you do.
It's an amazing career. I love it, and for multiple reasons. But being able to help people on this level, it's a sense that they use every day, and at the most basic need is our eyesight. We wake up, and if we can't see, we look for our glasses or our contacts. It's how we start our day. It's how we end our day. It's how we communicate and perceive the world around us.
Yeah, how we perceive our day. I was just going to say that. It's so important, every waking hour that you have.
And in my opinion, it's the most valuable sense that a patient possesses.